Let's take a look at the next case, which is case number 14. A 32-year-old man with AIDS presents to the emergency department with complaints of worsening headache, fever, and a stiff neck. Lumbar puncture is performed, and analysis reveals an elevated opening pressure, increased protein level, and decreased glucose level. Special staining of the spinal fluid reveals budding yeast. What is the most likely diagnosis? Cryptococcal meningitis is the most common fungal cause of meningitis and is prevalent among patients with AIDS. What microorganism causes this disease? Cryptococcus neoformans is heavily encapsulated yeast. It is found only as a yeast. It is not a dimorphic microorganism. How does this microorganism cause illness? C. neoformans is found in pigeon droppings and in soil. When inhaled, the yeast causes a local infection in the lung. This infection can be asymptomatic or can result in pneumonia. Hematogenous spread to the central nervous system can result in meningitis and brain abscesses. As in other common causes of meningitis, the capsule is thought to be an important virulence factor for gaining access into the CNS. HIV or AIDS patients with CD4 cell counts of less than 50 cells per millimeter cubed are at risk for what other infections? AIDS patients with CD4 cell count of less than 50 cells per millimeter cubed are at risk for cytomegalovirus, retinitis, esophagitis, and Mycobacterium avium intracellular, which produces disseminated gastrointestinal and pulmonary disease. Prophylaxis includes ganciclovir and azithromycin, respectively. CD4 cell counts are typically at or below what level when infection with this microorganism occurs? C. neoformans usually infect severely lymphopenic patients with CD4 cell counts of less than 50 cells per millimeter cubed. What is the appropriate treatment for this condition? Patients who are not immunocompromised can be treated sufficiently with amphotericin B and flucytosine for the meningitis. Patients with AIDS require long-term suppression with fluconazole after induction with amphotericin B and flucytosine. In these patients, long-term suppression may be stopped if the patient responds to highly active antiretroviral therapy, or HAART, and has repeated measurements demonstrating high CD4 counts. What cerebrospinal fluid findings are expected in this condition? Like viral meningitis, fungal meningitis has an elevated WBC count with a lymphocytic predominance. However, all other laboratory results mimic those of bacterial meningitis: increased opening pressure, increased protein, and decreased glucose in cerebrospinal fluid. So we have to look at the table 3. So let's take a look at that. See if we can see it. So here's table 3-1, cerebrospinal findings in meningitis. It's not focusing very well. Anyway, for bacterial, you have an increased bacterial meningitis. You have an increased pressure, and cell type is increased PMNs, protein is increased, and glucose is decreased. For fungal meningitis or tuberculosis, you have an increased pressure, increased lymphocytes, increased protein, and decreased glucose. For viral meningitis, then you'd have normal or increased pressure, increased lymphocytes, normal protein, and normal glucose. So this is a good table here. Take a look here at the picture of the Cryptococcus neoformans, how it looks.